Jennifer, thanks for being with me today. I'd love if you could share some trends that you're seeing in the healthcare payer industry. And, just as a sidebar, as we were discussing this and prepping for this discussion, what I found most interesting, and I think our viewers will too, is that we have the same macro issues facing this industry as we see in others, but the impacts are so different. So can you give us some perspective on that?
Yeah, absolutely. And I find that interesting as well, but I'm actually not surprised as I go through this. I can see why. If I think about from a macro perspective, there are five issues. The first being, financial pressure and medical cost trends are on the rise. And the reason for this is the pharmaceutical and specialty drug prices and such as GLP-1s have high cost, and those high costs, hit the margins. And there's also the pent up utilization from COVID that still payers are working through. As a result, payers are looking to how do they transform their business. They are financially struggling and reducing workforces. If you go out there publicly, you'll see lots of health plans saying they're reducing heads, et cetera. So when you think about this with the reduction of workforce, change and transformation, internal audit as being a risk agents for the organization really need to be sitting at the table, whether there's a new way of doing the process or whether someone's walking out the door with 30 years of experience that opens a huge risk factor there because there's a process missing is something they need to consider. Number two is government programs, which is defined as Medicare and Medicaid. Over 70 million Americans are covered by Medicare and 90 million are covered by Medicaid. And there's a lot of focus on these topics with the new administration. How do we reduce costs to these federally funded and state programs? Medicaid being a big focus of late in the new administration is talking about how do they do their funding structure? Do they start to think through block grants? How do they make the state regulate this? Which means every state may regulate Medicaid very differently on a go-forward basis. And finally, when we think about government programs, being a risk professional, compliance comes top to mind. There are a lot of regulatory compliance requirements as a result of having Medicare and Medicaid that these health plans have to follow. Internal audit plays a big risk in understanding what those program changes are, what those compliance requirements are, and making sure they're being doing audits over them, such as the changes in the utilization management or risk adjustment programs. The third area is merger and acquisitions. I know there's a lot of that going on right now. In the payer space, payers are looking to how do they diversify themselves? How do they remain competitive? And how do they differentiate themselves? One way of doing this is, some are building back-end offices, helping process claims of other payers, or they're becoming a technology company, or they're becoming more of that clinical arm and bringing on lots of providers to be able to provide the end-to-end service. When you think about that, that's new risk profile that health plans haven't been used to having. Internal audit, being the risk professionals, really should be sitting at the table during mergers and acquisitions and divestitures and thinking about what that new risk profile will be and how would they approach that. The fourth area, no shock here, is cyber. 2024 had the largest number of significant cyber attacks in healthcare, which caused a huge number of disruption, the greatest disruption ever. And these attackers aren't going to let go. They are just going to get better and better. And all that you can do from a health plan perspective is be one step ahead and really invest in your resiliency and technology infrastructure at your organizations. Being that risk professional, you can provide and partner with your cyber folks. What are those new challenges? Bringing the right folks to the table and doing proactive audits in that space. And the final area is around data integrity and AI. Health plans have grown up with multiple different applications that serve their multiple different lines of business. So how do you ensure as you're going through the payer life cycle that data is complete and accurate and it's reporting what you actually need to report it on? And AI, as everyone is thinking about AI, how can I use it to be more effective and efficient in my job? When they think about payers, the biggest thing here is access to care. and you cannot, you don't want to prevent members from access to care. And AI can be used in multiple different areas, but being careful of how you use it in the business. You can introduce bias in decision making. You could, inadvertently deny coverage where you don't need to. So, internal audit plays a big role in really understanding what is the company's AI strategy. How are you ensuring that when you are developing those AI strategies, you're building in accordance with your policy, with your technology is doing what it should be doing, and how are you testing it? Those are the 5 macro ones, Amanda, I would like to highlight that I'm seeing a lot in my client space today.
Yeah, thanks, Jennifer. So given the rapid pace of change in all of these areas, cybersecurity, technology development, our regulatory landscape, tell us how our viewers can stay up to date on these changing risk areas. Are there resources they can go to?
Yeah, absolutely. And this is a resource I use too, because it's changing so rapidly. We have at PwC called our Health Policy and Intelligence Institute, or we call it HIPPI. And everything's on pwc.com. And it has the most recent thought leadership of what's going on, from a regulatory perspective, and how does that impact payers in this case, whether it be through the new administration or new regulatory requirements changing. So staying on top of that is critical, and helping and talking with our clients too, what they're facing is a critical step as well.
Fantastic. We'll link that for everyone here. So thanks so much, Jennifer, for your time, and appreciate it.
Thank you.